Welcome to the Gorgeous Glow Skin Show. I'm your host, Dr. Sonia Johnson. We're in Indianapolis, Indiana, in the park, and I'm just waiting for a few people to join us. So if you want to share this screen, just press the button at the bottom. Sharing is caring. If you have a friend that you think could listen to this message, would benefit from this message, tag them. Welcome to the Gorgeous Glow Skin Show. I'm your host, Dr. Sonia Johnson. I'm a board-certified dermatologist and creator of the Gorgeous RX system. I help women who have problems with their skin. And if you want to follow me, you can follow me on facebook.com/Dr. Sonia Johnson, DrSonyaJohnson. Today we're going to continue talking about the common everyday practices to unmask your beauty. And this is the second part of side effects. So the first one we talked about yesterday was about irritant dermatitis. And today we're going to talk about contact dermatitis. And the difference is contact dermatitis is when you get into something, so use a cream or soap or shampoo of some sort, and you're allergic to it and not know it a lot of times. And what that does is true contact dermatitis is when your immune system kicks in and thinks of that product as an offending agent, and it causes your immune system to go after it, and therefore you start developing a rash. And with that rash, you'll notice red areas as well as itching. And that's the big difference between irritant dermatitis and contact dermatitis. Yesterday we talked about irritant, and irritant dermatitis shows up as irritation, more burning, weeping, can have the same presentation, red area, but with contact dermatitis, an acute contact dermatitis is when you get blisters, but a subacute is when you get a dry rash that itches. For treatment for contact dermatitis, number one, of course, stopping the offending agent, but number two, you want to use a steroid cream, and that will help get rid of the eruption. Now, just keep in mind, you ask yourself, well, how am I supposed to know I'm allergic to it? And you won't. And a lot of times you have actually had the product before and it did not elicit a reaction, but it did make you sensitized to it. And when you got into it again, the second time, that's when you had the overt reaction that you didn't want to have. And again, that's a true contact dermatitis. So that's when you want to get rid of that product and not use it again, because you will have the same reaction again, if not worse. And it may come on faster than it did the second time. Any questions? Okay, well, again, I'm your host, Dr. Sonia Johnson. I'm a board-certified dermatologist and creator of Gorgeous Gorgeous RX system. And I help women with ethnic skin who want to have a clear and even skin tone. If you think that's you, follow me on facebook.com/Dr. Sonia Johnson, DrSonyaJohnson. Take care.